So Dr. Kotler, I know I have sinus issues, and I know people after the procedure are going to wonder, how am I going to breathe after this procedure? What can you tell us?
This is a great question. It's very important. And by the way, the breathing issue after surgery is somewhat dependent on what your breathing problems were before. For example, some people come in and they only require cosmetic surgery. We check the breathing, we check the passages, it's fine. They have no history of sinus problems, no history of broken nose, fine. But what about the patient that also can't breathe? Turns out this is the opportune time to correct that at the same surgical sitting, if you will. After all, one anesthesia, one recovery, even though it's a little bit longer if you combine them, but I'll talk about that in a second. And there's economy of dollars. So it makes sense. Patients come in often with the breathing being an equal concern to the appearance, particularly for men who've had athletic injuries, broken nose, never had it fixed. Well, this is the time to fix it all, and we have the ability to do that. Even people with allergies that are the main factor in the breathing problem before surgery can be helped. The breathing operation is called correction of the deviated septum, which is the crooked internal support beam, and trimming of the turbinates. Turbinates are little bulges inside the nose which get quite large, particularly with allergy. It is wise to correct that at the same time as the cosmetic. There is a bearing, however, on the immediate recovery period, meaning the first 5 days. While there's a 5-day period of keeping the plastic protector on the nose, because the outside's been operated on, that same 5-day period requires that the inside of the nose have some padding to allow the medications, such as platelet-rich plasma, antibiotics, blood vessel shrinkers to reduce the chance of bleeding. That padding has to stay inside the nose for the same 5 days when you do the combination. If you only do the cosmetic, the padding comes out the next day. But we do have an answer to the breathing problem. And it's really important because patients often worry more about the breathing than pain or recovery time or anything else. Well, I'm proud to say this is my invention. This is the Kotler nasal airway. 2 soft, smooth plastic tubes that the surgeon inserts at the end of the operation, after the operation is done, before the patient wakes up. It's like a little bypass. The air goes through, regardless of whether there's a lot of swelling in the nose or a little bit of swelling or the padding's in there. The patient can be comforting to know that they can breathe. And it's important. And we provide, again, all the supplies necessary to keep it open, have it working. And the removal is quite simple and quick and painless because we dribble liquid anesthetic into the nose and it slides out because it's not stitched in. Patients gave it a 98% endorsement. 98% of patients feel that this was a very important and positive part of the experience. I'm proud that we could deliver that extra level of service for patient comfort and safety.
And I know breathing's important. I have claustrophobia, so I want to be able to breathe. So they can request this no matter where they get their procedure done.
Absolutely right. And that's claustrophobia, by the way, is a problem for some people who have the nose is not functioning perfectly because of the extent of the surgery.
Wow, you're a Renaissance man, inventor too.
Yes, and a patient kind of said, if I can't breathe well after surgery, bye-bye. And I'm thinking, no, we got to help this guy. And that led to the invention of that.
That's
it's
amazing.
Patented, FDA approved, and very proud of it.
Wow, that's great.
Thank you.